Hello classmates, welcome to the online classroom of Chinese medicine gerontology. Today we are continue to study the course of pain syndrome in the Italy. Last class we studied the etiology and pathogen of pain syndrome in the Italy. Let's take two common types of pain as an example to discuss Italy pain syndrome. Cancer pain. Cold evil stagnation, yang qi is not reached, qi and blood are not smooth, and transcirculation can cause pain. Various causes such as unstable emotions can cause the body qi and blood to malfunction. The qi movement is blocked and the blood is stopped. The jing is coagulated and the meridians are blocked, and the qi and blood fluids are not aggregated. The occurrence of the cancer pain, blood stasis, is a pathological product of the body and one of the pathological foundations of cancer. The poor blood flow is caused by the disorder of the qi movement. The internal blood stasis causes the collaterals and the pain. Film turbidity is a product of the disorder of auto metabolism. Film stops inside and gathers into a tumor. Stooms is a thing, it goes up and down everywhere with the gas. Film turbidity can block the vessel meridian and aggravate the lumps, causing vessel meridian qi and blood disorders, and cancer pain caused by unfavorable meridian qi. Film and turbidity are often combined with qi stagnation, blood stasis, auto dampness, and fire poison to cause disease. Cancer, for a long time, had endogens, injuring the organs and meridians, and qi and blood were combined with film and turbidity, blocking meridian and blood running, or injury can cause pain. Chronic illness is caused by disaffection of qi, insomnia of the body, inadequate qi and blood fluid, dysfunction of vessel and organ, and dysfunction of vessel meridian causing pain. Differentiation and treatment. For qi stagnation and blood stasis type, it is advisable to use 四逆散 plus 盐胡索 or add 疏肝理气 as appropriate based on 血府逐瘀 dictation. Those with film and blood stasis can dissolve film and remove blood stasis, and can add spleen invigorating products on the basis of 千金伪净汤. Those with cancer poison should clean away the heat and detoxify, and add dry medicine on the basis of 如意金黄散. Deficiency of qi and blood type, mainly focusing on correcting the body, 八珍 dictation and 当归四逆 dictation to supplement qi and blood, warming and despairing cold. At the same time of treatment based on syndrome differentiation, some traditional Chinese medicines with anti-tumor effects such as 猫爪草, 东林草, 三慈菇, etc. should be added up to help relieve pain. Studies have shown that for the nerves damage after radiotherapy and chemotherapy, 补阳还五 dictation has a significant effect. 芍药甘草 dictation has a protective effect on the neurons around the tumor damage by hypoxia and inflammation, which can reduce the occurrence of cancer pain. In general, the pathology of cancer pain is relevantly complicated, and the treatment of the pure or the stasis may be too one-sided. to distinguish between the patients or the congestion of the stasis or the deficiency, to observe the pathologies, to treat the syndrome according to the syndrome, to use it flexibly, and treat it as appropriate. It is still the general principle of treatment. Osteoporosis. Osteoporosis is a metabolic bone disease characterized by reduced bone masses and distraction of bone tissue microstructure, which leads to increased bone fragility and easy fracture. Most patients suffer from pain. In recent years, with the intensification of the aging population, the incidence of osteoporosis in Italy has increased year by year. WHO has listed osteoporosis as one of the three major diseases of Italy. Osteoporosis belongs to the categories of bone atrophy, bone paralysis, bone dryness, and so on in traditional Chinese medicine. Etiology and pathogenesis. Su Wen said, kidneys are watery organ, but water is invisible, and the bones are dry and the marrow is weak. The kidney is a congestional foundation. It mainly contains essence, material of bone marrow, and the growth and development of bone and closely related to the rise and falls of kidney essence. The spleen and stomach function is weak. Transportation and transformation is lost. It is lost to nourish, and causing congestion causes osteoporosis. Liver maintenance. Golden and water coexist. Deficiency of liver yin will lead to deficiency of kidney essence and bone atrophy. At the same time, the deficiency of spleen and kidney, the infiltration of complex sections of external evils, and the development of cold and dampness, chi stagnation, and blood stasis are also the pathogenesis of the disease. Therefore, the disease is based on kidney deficiency and involves liver and spleen. This disease is based on the zero, internal weakness with external excess. With liver and kidney deficiency and spleen hyperfunction, it took up film and blood stasis from the symptoms. Treatment characteristics focused on the kidney, liver and kidney, blood circulation and film, smooth blood and qi, blood circulation, pain relief, kidney deficiency and marrow deficiency. The essence of kidney is the essence of bones and marrow, which hides the original yin and resides the original yang. It is innate foundation of the human body. With the increase of age, kidney yang is deficient and the blood is insufficient, which makes the bone marrow empty and become bone cellus. According to deficiency of kidney yin and deficiency of kidney yang, you can use 右归丸、知白地黄丸 or 左归丸。Spleen and kidney yang deficiency. The spleen is responsible for the subtlety of the water and food, which is the source of the source of qi and blood biochemistry. The essence of food and water, then it can be turned into qi, blood, essence, body fluid, to nourish the bones to make them strong and powerful. Therefore, Lin Shu Jueqi said, the food is full of qi, and the less is on the bone. If the old person's spleen and stomach are weak, the subtitle function of receiving, transporting, and distributing the water and food will be dysfunctional, and the required essential cannot nourish the kidney in kidney essence. Without bone marrow, nourishment and bone atrophy, spleen and kidney yang deficiency can be added to 金匮肾气丸. Liver and kidney yin deficiency. Liver and kidney are the same original. Liver stores blood, kidney stores essence. And essence and blood altered. Old people often have insufficient liver and kidney. And the liver manages tendon, the kidney manages bones, and the tendons and bones allows to the blood and essence to form the disease of bone atrophy and bone parasites. Liver and kidney yin deficiency can be added or subtracted by 大补阴丸, film and blood stasis. 读医随笔 documented. Yang deficiency, blood will congeal. Yin deficiency, blood will stagnate. Old people who has qi and blood are weak and unable to push blood and cause blood stasis, insufficiency of kidney yin, deficiency of cold endogenous, cold coagulation and blood stagnation, deficiency of kidney yin, blood veins astringent, blood stagnation and astringency and deficiency of fire, blood sinking and slowing to cause stasis, or spleen deficiency and dampness, weight gather into film. Film and blood stasis blocks the normal physiological function of meridians and bones, but pain causes bone atrophy. Film and blood stasis block can be treated with 桃红四物汤 and 活络丹. To sum up, clinical, the importance of nature of pain and its accompanying symptom on differentiation treatment should be emphasized. Pain is still in a state that has not been yet fully explained, and effective pain treatment must be based on a clear diagnosis. Since the balance of any aspect of organs, 营血, blood and qi, and spirit will cause pain. So, it is very important to identify the nature of pain, combine the location and pain and the accompanying symptoms, and accurately treat the syndrome based on syndrome differentiation, such as 林书百病始生 says. Checking the pain, knowing what it should be. 0 are more than enough. When the supplement is supplemented, when the excess should be weakened. Above, we have learned the understanding of Chinese and Western medicine on the etiology, pathology, diagnosis, and treatment of the senile pain. I hope that students will carefully sort out and summarize after class. Okay, that's all for today's class. Thank you all.